vitamin A deficiency is kind of a big deal in India. Like it's a national level health program which we are looking at. We have a national program, a national prophylaxis program for the prevention of blindness due to the deficiency of vitamin A. So there does exist a vitamin A prophylaxis program just to treat blindness among the Indian population. Okay, so the recent statistics of vitamin A deficiency in India state-wise can be seen here in this page. So it's very common in the state of Tripura, Mizoram, Jharkhand, okay, and some other backward states, Bihar, Chhattisgarh, Madhya Pradesh, Haryana, etc. Okay, so yeah, on top of that, remember this thing when during the time of infancy, okay, when the kids are too small during the time of infancy, vitamin E deficiency is not that common because the child's liver has enough stores of vitamin A from the mother's breast milk, okay, whatever they have accumulated. But the vitamin A deficiency risk will start once the child enters into the preschool age, okay, that is from 3-year old to 6-year old, okay. This is the high time of observing various signs and symptoms which relates to vitamin A deficiency, okay. So the diet of the child, especially when the children are in this particular age group from 3 years old to 6-year old, uh, a particular concentration should be given to the vitamin A content in their diet. They are at more risk. The preschool children are at more risk of getting vitamin A deficiencies. Okay, so that's the prevalence rate in India. This is the recent one which I have shown. In textbook, they have given some different prevalence rates. So epidemiology, the meaning of epidemiology is the study of people, okay, study of a given population. So that's the breakdown of the epidemiology word meaning. I have shown it in the screen. Okay, epi means upon, demi people, logy study. Okay, so study on the people, study of the population, okay, for any given factors. So epidemiologically speaking, age, okay, again, I'm repeating myself, when a child is in the age of like 1 to 3 years or 3 to 6 years in the preschool era, okay, that's when they are at highest risk of developing vitamin A deficiency as compared to infants or any other age groups, okay. And next is the socioeconomic factors. So the children who are brought up or who are from a tribal area or from rural areas, children who belong to low socioeconomic class families, okay, so they are also at a higher risk of getting vitamin A deficiency and its associated disorders. So we have a prophylaxis for vitamin A, which is compulsory should be given to all the children, also to pregnant mothers and lactating mothers. We'll see that later in the last part of this particular chapter, the prevention of vitamin A deficiency, the immunization schedule, the prophylaxis program which we have. Okay, we'll discuss on that later. So etiology means causes. Okay, what are the reasons which lead to vitamin A deficiency? So it's a medical terminology, etiology, or you can just call it as causes of vitamin A deficiency. Okay, those who are not from the medical background, for them. So inadequate dietary intake, that is the first and the foremost reason, especially when a deficient vitamin A deficient diet was consumed by the mother during her pregnancy or during her lactation phase, okay, that may lead to low vitamin A stores in the infant, and that will get depleted very soon. It will get this little bit of vitamin A stores which the child has accumulated during breastfeeding, etc. Okay, during the best from the breast milk, that will also get depleted soon before the child reaches the age of 3. Okay, so inadequate dietary intake. Okay, and when people grow old and as soon as they cross the preschool age, again when the diet is not having enough food that is a rich source of vitamin A or beta carotene, okay, that may lead to deficient states. So yeah, can you give me the examples from previous class? Can you give me the examples? Give me first the examples of animal sources. Okay, animal sources which are good and rich in vitamin A. Yes, eggs, milk, liver, fish liver oil, cod liver oil. Okay, these are great sources of vitamin A. And is the vitamin A, how is the vitamin A found in these animal sources? Is it found as it is in the form of vitamin A, or is it is formed in precursors of vitamin A? In animal sources, how do you find vitamin A? Is it the form of vitamin A which can be readily absorbed, or is it precursor of vitamin A? Yes, retinol is the correct answer. It is formed. Retinol is a form of vitamin A. It is not the precursor of vitamin A. The precursors you will find in plant sources, not in animal sources. You will find the precursors of vitamin A in the plant sources like alpha carotene, beta carotene, lycopene, etc. Precursors are in plants. Okay, the precursors of vitamin A has to go certain processes, certain chemical processes to become active form of vitamin A so that it can be readily absorbed by the intestine and be stored in the liver. Okay. Inadequate intestinal absorption. This happens when, especially in preschool children and in kids, when they suffer from chronic infections or even hookworm infections or any kind of worm infestations. Children who suffer from measles, who have not got the measles vaccine and they get infected with mumps, measles, or even chicken pox. Okay, such infections, when the kids are undergoing such infections, automatically their intestinal absorption will reduce. Okay, even if the diet is rich in vitamin A, the intestine will not be able to absorb the vitamin A during that sick state. Okay, so that may lead to deficiency. So infections, if not treated on time, if you make an acute infection and do not treat it, do not give them proper treatment, lag it on and make it a chronic infection, that's when the child is at the risk of being deficient in vitamin A. Increased excretion, this is seen when during when the child is suffering from some diarrhea. Okay, some food intolerance, food sensitivity. Okay, in adults who suffer from cancer, any types of cancer, in that it is seen their excretion, their excreta will have a lot of vitamin A expelled out of the body. As it is, it will not be absorbed. And people who suffer from any form of infection, here in the textbook it is given UTIs, urinary tract infection. Not just that, but any forms of infection, vitamin A will be excreted out of the body because intestinal absorption is reduced. Or that's a direct causative factor. If the intestinal absorption is reduced, what is the next step? Whatever vitamin A is present in the chyme that enters the intestine, it will be expelled from the body as it is. Okay, then we have ignorance. There are certain beliefs like do not consume papaya during pregnancy. Okay, that's a very common belief among most of the cultures we see around. Okay, so that's some these false beliefs and myths may lead to vitamin A deficiency. Also, ignorance means that the female literacy rate in India is quite low as compared to the male literacy rate. Okay, so this literacy rate may also affect their knowledge about certain nutritional resources of vitamin A, etc. They may not know what is good for them, what is bad for them, etc. So that may lead to deficiency. Then improper cooking methods. Can you give me any example of this? Because in last class, those who have attended, not the new students or who are attending this for the first time, in the last class, can you give me an example which cooking method can lead to loss of vitamin A? Yeah, deep frying or cooking. Yeah, washing the vegetables after cutting them, overcooking. Yeah, using microwave ovens for cooking. Yeah, that will also lead to loss of vitamin A. And which are the best methods of cooking a food rich in vitamin A? Give me the best methods. Boiling, steaming, also sauteing. Okay, always remember, not too much of oil but little bit of oil which you use especially to saute any vegetables. Okay, that will lead to that will lead to retention of beta carotene, especially while cooking plant food or vegetarian foods. Okay, and also remember this thing, adding tomatoes. Okay, adding tomatoes when you are dealing with green leafy vegetables, adding tomatoes to green leafy vegetables during cooking, that will save the beta carotene. Okay, yeah, covering the food while cooking. These are the methods through which you can retain most of the beta carotene, especially in from plant sources. Next, levels of vitamin A status. So here they have given preclinical deficiency when you do certain assays of the liver or biopsy of the liver, or we have isotope dilution assay of the liver, etc. These are various medical terminologies used in biochemistry and microbiology, etc. To test what is the level of vitamin A concentration in this particular individual's body. Okay, so these are the different tests and the results of the test. When we do a liver assay and we find the vitamin A status in this particular individual's body is less than 0.07 mu mole per gram wet weight. Why we are using wet weight here? Because when we do these isotope dilution assays, etc., we do not exclude water. Okay, whatever sample we get, okay, whatever sample we are taking from this body, every sample, whatever sample we take, okay, even if it is blood, plasma, urine, biopsy specimens, etc., it obviously each and every cell contains water. So it is concluded that each and every body tissues and cells have water, so samples will contain water. So including the water weight, what is the concentration of vitamin A present? So that is why we have used the term here, wet weight of vitamin A, including the water. Okay, so including the water weight in the sample, this should be the concentration level. If it is this particular concentration level which is on the screen, that is less than 0.07 mu mole, okay, it means that it is a preclinical deficiency state. Means the person, if not treated, if you are not giving vitamin A supplement to this particular individual, he or she may lead to a complete state of vitamin A deficiency. So this is the preclinical deficiency state. So we can actively, just through oral supplementation itself, we can correct this area. Okay, then satisfactory levels, where even if the dietary intake of vitamin A is less, but still it is enough to make a good use of that low source of vitamin A and keep your physiological functions in the body active and not impaired. Okay, these are the satisfactory levels. So if a male who is around 75 kg, this should be the satisfactory level of vitamin A concentration in their samples. Okay, so that is 0.18 mmol. And if it's a female, if it's a woman, weighing around 62 kg, 0.14 mmol should be the satisfactory levels present in their samples. Okay, retinol samples present in their blood sample, serum sample, etc. So that with this levels we can say, okay, even if their diet is deficient in vitamin A, but still their body has enough resource, enough store for at least the next 3 months. Okay, from here you can give them the advice of nutritional importance of vitamin A, which are the good sources which they can incorporate, so that after these 3 months of depleting their vitamin A stores, they should not go into the stage of deficiency. Okay, that kind of education you can give here. Next, coming to the clinical features of vitamin A deficiency, the first thing is the effect of eye, night blindness. Okay, and there are various xerophthalmia. Night blindness is the first stage of xerophthalmia. Xerophthalmia has various stages. We will see each of them in the coming up slides. Okay, so the first effect is on eye. The first sign and symptom which you can see is when you visit a movie theater. Okay, as from a bright light of the mall or outside, when you enter into the movie theater, okay, how quickly your eyes can accommodate the darkness of the movie theater while you're searching for your seats. Okay, if the movie has already begun or if it is not begun, you are in that stage, you're searching for the seats. Okay, how easy for it is for you to search for your seats in that dim light of a movie theater. Okay, if somebody finds it very easy, even in that dim light, they are able to follow the lights which is shown on the staircase and they can find their seat easily, means they are not vitamin A deficient. But if people, even with the help of that small blinking lights in the staircase, etc., even with the help of that, they are not able to search their seat, they are tumbling around, uh, they are not able to move forward. Okay, that's a sign of vitamin A deficiency. So that is a starting phase of night blindness. Okay, and they find it very difficult, especially if it is adults, and they find it very difficult to drive during night. Okay, they find it difficult even to follow the traffic instructions during night. They can only see what cars are there in front of them but not side to their sides, etc. Okay, these are the you can ask this kind of questions to people whom you suspect of having vitamin A deficiency. Okay, then effect of growth, obviously vitamin A is required for calcium and phosphorus absorption for the skeletal muscle skeletal development. Okay, and vitamin A is deficient, calcium absorption will not be adequate. Okay, that will lead to growth retardation in kids. Then effect on reproduction. For males, their germinal cells, germinal epithelium will not be able to grow healthy spermatozoa. Okay, that may lead to male sterility. Okay, fertility issues in males. And when it comes to females, those who are already pregnant, if they are in the state of deficiency, it may lead to some preterm labor, preterm birth. Okay, spontaneous abortions or fetal death. Okay, these things can happen during pregnancy. Then increase susceptibility to infection, because vitamin A, even in the previous class I have told you, cilia. Okay, cilia is there in your throat. Okay, in your trachea, and cilia are the small finger like projections that will, as soon as a microbes or a dust enters your respiratory system, these cilia will secrete mucus, and this mucus will trap this dust and microorganism, and the cilia will make sure in an upward movement these trapped microorganisms or dust will be expelled out through the nose. Okay, it will make cilia make sure that these dust and microorganisms should not reach in the interior lobes of the lungs. Okay, and since they have this smooth texture, smooth and flowy finger like projections along with the help of mucus production, they are able to do this function. Okay, but in case of vitamin A deficiency, mucus production will not be adequate. On top of that, this cilia, which are like smooth finger like projections, they will undergo keratinization. Keratinization means they will dry up. When these cilia will dry up, they will not do the function of moving around in a wave like form and expelling the dust and microbes which they have trapped. They can't expel them outside. They can't move the dust and microbes from the interior lobes or in interior side of the tracheas to the upper respiratory system. They can't do that job. So automatically your humoral immunity is at risk, is impaired. Okay, this is your first line of defense. Okay, your first line of defense is impaired. So that is how you will be susceptible to a lot of infection because of this reason. Then, especially when it comes to pregnancy, there is a risk of preterm delivery, as I told earlier. Pregnancy-induced hypertension (PIH), okay, BP, especially during the gestational period. Okay, especially during the pregnancy, this woman was not having any issue with hypertension before she got pregnant, but as soon as she got pregnant during her gestational period, we have witnessed BP. BP means even within the 6 hours interval. Okay, for example, at 12 p.m. we took her BP, it was high, it was above 140 by 100 mm of Hg, and after 6 hours again when we checked her BP, it is still high. So that's one diagnosis of pregnancy induced hypertension. Okay, so vitamin A deficiency during pregnancy will lead to PIH, and anemia, because anemia and vitamin A deficiency is interrelated. Again, vitamin A is required for non-heme absorption from your intestine. If vitamin A is deficient in your body, iron will not be absorbed. So along with vitamin A deficiency, you are dealing with anemia also. Okay, so these are the few critical features. So yeah, xerophthalmia, that's the main thing here. The main problem which we are facing in India, that is like nutritional deficiency, blindness related to nutritional deficiency, that has to be prevented. And this program, National Prophylaxis Program against the prevention of nutritional blindness, okay, that is completely took over. It is completely funded by the central government and the Ministry of Family and Health of Welfare. Okay, so that ministry has completely funded this particular national health program, and the task of them task what they have in front of them is that just because of nutritional deficiency of vitamin A, no citizen of India should turn blind. Okay, nobody should face blindness just because of the vitamin A deficiency. Okay, so there are other causes of blindness, some genetic reasons which we do not have much control of, some accidents, etc. Okay, those things we do not have much control of, but preventing my blindness just through ensuring adequate nutrition to your population, that is something the government should do, and government is to an extent they are able to control it. Okay, so yeah, xerophthalmia, that is the medical terminology which we use for the deficiency of vitamin A. Okay, it has various stages. It starts with XN stage, which is night blindness. Okay, then it will slowly proceed to up till Bitot spot. Okay, up to this X1B. Okay, till this third stage it is reversible. Okay, till this stage, even if an individual reaches to this third stage, we can still reverse it back to a normal healthy vision. But after this stage, when the corneal cirrhosis, corneal ulceration, these things start, complete vision, when it comes to keratomalacia second stage, it is complete loss of vision. Okay, corneal cirrhosis and corneal ulceration, it has loss of vision, but some blurred vision can be, if treated properly and on time. Okay, we can at least save some amount of the vision. Okay, because blindness has a rate, total blindness or to a certain degree of blindness. Okay, so yeah, when it is keratomalacia stage 2, that is X3B, that leads to complete blindness. Corneal scar, complete blindness. Xerophthalmic fundus, that is also complete blindness. Then we have PXN, that is maternal night blindness, when a pregnant lady is having vitamin A deficiency and she's not able to accommodate her vision from bright to dim light. Okay, during her pregnancy. So that is maternal night blindness. That's a new stage which we have added here. So yeah, these are the different phases of night blindness. So the first XN, that is night blindness, you can see how a normal vision is and how a person who is suffering from night blindness visualizes during night. Okay, even with the traffic lights and street lights around, you can see the degree of their vision. Okay, how difficult it is for them, especially if they're driving at night, etc. Okay, from the next slides onwards, there are few images that I guess not everyone of you will be comfortable with. Okay, so if you do not want wish to see few images which is coming up, you can just avoid seeing looking at your screen. Okay, especially those who are not from the medical background, you may find uncomfortable seeing these images of mitoid spots or corneal xeroxis, etc. Some images are given in the textbook also. So the next stage is conjunctival xerosis. So conjunctiva, this is the white area of your eye. Okay, you can see how it has become. You can imagine how a healthy eye should look like, and how wrinkled, dry, and how lusterless is this section of the eye which is suffering from conjunctival xerosis. Again, this is reversible with proper diet and proper immediate supplementation of 2 lakhs international unit of vitamin A. We can reverse it back to normal. Okay, several weeks treatment is required to reverse it back to normal, but still vision is not lost here. So that this is how conjunctival cirrhosis looks like. Here I have shown you the wrinkled example of it. In some cases of congenital xeroxis, you can see some muddy like spots, like brown spots here. Okay, that is also the same. That is also coming under the same category. Next, we have Bitot spots. Bitot spots are again of two types. One has this brown color spots, and next we have this cream like cheese like foamy textured spots in the eye. Again, Bitot spots is also reversible. This is Bitot spots is very commonly seen in preschool children. Okay, those who are deficient in vitamin A, conjunctival xerosis, and this thing. Bitot spot is very commonly seen in preschool kids. As soon as we see this particular Bitot spot, we do not wait for any laboratory results or any further diagnosis. As soon as the Anganwadi ayas or the preschool teachers or anyone in the family also for a community education, if somebody sees this kind of spots in the child's eye, without waiting for further diagnosis, immediately vitamin A prophylaxis should be started. Okay. So the first image shown here on the left side is the starting stage of Bitot spot, and if it is not treated, it will convert itself into this creamy kind of frothy kind of white patches, white triangular patches. Next, we have corneal xeroxis. So till the last stage, what we have seen is the things that is going wrong with your conjunctiva, that is the white portion of your eye. Now the cornea, that's the entire where the pigment of the eye remains, okay, which includes your iris, pupil, etc. Okay, the cornea will undergo xeroxis, that is dryness, and again the vision will be impaired here. In the Bitot spots, the normal vision will not be that impaired as compared to the corneal cirrhosis. Here in the corneal cirrhosis, vision becomes impaired, and sometimes it may lead to complete loss of vision. Sometimes some degree of loss of vision. But again, even if you try to reverse it back, it will never go to a healthy state. Treatment is given here. Again, this will lead to blindness because of nutritional deficiency in children, in preschool children, and in tribal regions, in rural in very rural India, remote rural India, this corneal cirrhosis is very frequently seen. And this is keratomalacia. Keratomalacia means your cornea will completely melt out. Okay, it will melt down. It will lead to complete blindness. Okay, there is no going back from keratomalacia. Person suffering from keratomalacia will lose their complete vision. Okay, this lesion which occurred because of drying of the cornea, etc., it can only heal once the scar tissue has formed. And when the scar tissue has formed in the eyes, sometimes if it is too severe, the entire eyeball has to be removed. Okay, this infection can lead into the entire eyeball, so that it doesn't reaches the optic nerve, or it doesn't, this infection doesn't go any further. Okay, the entire eyeball will be extracted out to safeguard the other functions of the optic nerve, etc. So again, from in keratomalacia, remember that it is the softening and the dissolution. Okay, the cornea will melt down. It will get like wasting of the cornea. We can understand it like that way: melting of the cornea or wasting of the cornea. It can only heal when the scar tissue is formed. When the scar tissue is formed, scar tissue is not as functional as the healthy eyes tissue. Here you will witness complete loss of blindness. Okay. So next, coming to evaluation. So we are done with the images of different phases of xerophthalmia. So coming to evaluation, various tests which we can take to see what is the serum retinol level, or what is the liver concentration of vitamin E, or any other concentration of vitamin A found in various body fluids or tissues. So first is the liver vitamin A concentration. You can either do a small biopsy of the liver tissue, or you can undergo isotope dissolution or isotope dilution assay, which, as I had explained earlier, in isotope dilution assay, we will include the weight of the water also from the samples which we have took. Okay, water weight is also included. So that's one test. Then we have the serum vitamin A. Normally, your complete blood test, or any laboratory blood test specifically treated to identify the deficiencies, you will get this result. The serum vitamin A should not be below 10 mu per deciliter. Okay, if the serum vitamin A is below 10, it means the person is deficient. Then we have dose response test. Okay, first, in what you have to do here is, the medical professionals will do this. Okay, the person who comes in for this test, their initial blood serum level for retinol, etc., is checked. Okay, and after that, small doses of vitamin A will be given to them, and over a period of several hours, their samples will be collected, and it will be checked that how well is the retinol binding protein being secreted in their body. Okay, if somebody is deficient, every hour when they check this retinol binding protein levels in their blood sample, etc., if somebody is deficient, their RBP levels will be very high, much higher, and it will stay in the plasma for a very long time after the vitamin A doses have been given to this particular individual. So that's one classical sign that this person is deficient in vitamin A. Okay, so that is a dose response test. We will give the dose of vitamin A, and we will check the response of the person via their blood serum level, etc. They will check the response, how the body is responding to various doses of vitamin A. So that is the dose response test. Then we have conjunctival impression cytology. Cytology means study of the cells. Cell logy study. Okay, so what we do here is, with the help of filter paper, or at least that blotting paper. Okay, it will be not using very hard force. Okay, mildly we'll just keep the filter paper or the blotting paper on the conjunctiva, and the filter paper will absorb the tears, and along with that, some cells of the conjunctiva will get stuck to this blotting paper, and after that, that portion of the blotting paper will be checked under microscope. Okay, because under the microscope, the microbiologist and the lab technicians, they know how the healthy cells of conjunctiva should look like, and how the keratinized cell of conjunctiva will look like. Okay, so when they find that the cells which have stuck to the blotting paper is not seemingly it is not healthy. Okay, it is looking like it is in the initial stage of keratinization. So this is a good test to identify any vitamin A deficiency in the initial phase itself. But doing this conjunctival impression cytology for kids, okay, especially the kids who are under 3, doing this test on them, it is not feasible. Okay, on adults we can do, even on children who can follow the instructions, we can do this test. But for kids who are less than 3 years old, it's difficult to do this test on them. Then we have dark adaptation test. So in this, the speed at which a person is able to recover their night vision, that is checked. Again, the same thing applies here. On kids, we can't do this test, because when a person goes from a bright light to a dim light, okay, when he or she is an adult, they can um, explain what they are visualizing, they can explain what they are going through. Okay, they can accurately describe what needs to be described. Okay, but you can't expect kids, small children, to describe the same way how you want to hear it, or do you want to objectively understand if they are having any any negative response to dark adaptation test or not. So this dark adaptation test completely depends on how a person describes the feeling of coming from a bright light to to a dim light, how they're adjusting, okay, how long it is, what kind of initial few objects which they can see, and after few seconds what else they can see, okay, that kind of description they need to give. So only adults and kids who can follow the instructions, only they can follow up with this test. Small children will not be able to describe this test into that particular point to point description. Then we have metabolic indicators. These are biochemistry assays, okay, like an ammonia nitrogen in the feces, and other erythrocyte oxidative stress test in the blood sample. Okay, these are the biochemistry part of the laboratory. Yeah, functional tests, the same thing, ammonia test and erythrocyte oxidative test. Metabolic indicator is the amount of retinol beta glucuronide test. Okay, I don't know how to pronounce that, but some byproduct of the retina, when the retinol is undergoing some metabolic reaction in your body, there will be some byproduct of retinol left. Okay, so identifying what is the amount of that byproduct of retinol left in the blood sample or the urine, that is the metabolic indicator. And functional test, ammonia test in the excreta, in the feces, and from the blood sample, what is your erythrocyte oxidative stress. Then breast milk retinol, only for lactating mothers you can do that. For pregnant mothers or for the women, and this is only an exception for lactating mothers, because your vitamin A status, what is your vitamin A status during the morning, okay, when you do a blood test or a vitamin A serum retinol test in the morning, there will be some result, and when you do in the evening there will be some different result. Okay, so the vitamin A serum levels will differentiate throughout the day. Okay, it will be different throughout the day. But when it comes to breast milk retinol, okay, it gives the exclusive exact amount of what is the concentration of vitamin A stores present in the mother's body, okay, lactating mother's body. So that's the breast milk retinol test. Then we have tear fluid retinol test on kids as well as for adults. We can do this. The tear which has been secreted uh, uh, by the tear ducts, tear glands in your eyes, okay, that will also have certain amount of retinol. The more mu mole gram of this tear fluid retinol which is available, it is mentioned in the textbook. The plasma retinol, liver retinol, etc. is mentioned here. You can just go through that on page number 311, table 16.2. Okay, different values, etc. But again, I'm repeating the same thing, the values which is given in the book, and in the future when you do a vitamin deficiency test, the reference value which you get from the microbiology laboratory, etc., it will be completely different. Okay, for an exam purpose, just follow what is there in the textbook, but in practical purpose, every laboratory will have their own reference value, etc., for this serum retinol, tear fluid retinol, breast milk retinol, etc. So you can take a screenshot of this particular image. Various indicators like serum retinol, breast milk retinol, dose response test, isotope dilution, liver sample, the biopsy sample, etc. Okay, what which mu mole per gram will be deficient, will be considered as deficient, which is toxic. It is given in this particular image. You can take a screenshot of this. Again, the reference value which they have given here in the second row, this reference value may slightly vary with other laboratory reference values. So now coming to the treatment, mostly we do depend on the vitamin A prophylaxis to take care of the treatment necessities throughout the country. Okay, but apart from that, even in private consultation, treatments can be given. Okay, from primary healthcare also, vitamin A prophylaxis treatment can be given. So vitamin A deficiency should be treated urgently, because when it comes to a person who is in corneal xerosis, and within few hours, if it is not treated, if a high doses of vitamin A is not administered within few hours, they may go from that stage of corneal cirrhosis, they can go to keratomalacia. Okay, it may take just few hours for this person to go from partial blindness to complete blindness. Okay, so the time is of an essence here. So yeah, it should be treated urgently. As soon as you see the whiteout spots or anything, don't wait for the diagnosis to confirm vitamin A deficiency. Automatically vitamin A doses can be administered. Nearly all early stages of xerophthalmia, that is night blindness, mitoid spots, conjunctival xerosis, these three early stages can be reversed completely into complete healthy vision. Okay, then administration of massive doses of vitamin A in the form of retinol palmitate orally. Okay, 2 lakh international unit of retinol palmitate will be given in 2 successive days, means today one and tomorrow another dose. All children with corneal ulcers are given vitamin A, whether or not deficiency is suspected. This is the reason why in preschools, in kindergartens, etc., the kindergarten teachers, etc., they are taught how to identify white hot spots, early stage of white hot spot, later stage of white hot spots in the kids. Okay, even in the preschool teachers, they are given this form of training to identify that in the classroom itself, and then report it to the administration or to the parents to take the child to a PHC. So yeah, take a screenshot of this. This particular thing is again explained in your textbook. It's the same thing. Okay, the treatment schedules. Okay, immediately on diagnosis, how much we have to give, and when the child is of what age, what dose we should give. It is given here. Newborns and early infants, only 50,000 international units. Children who are below 1 year of age, 1 lakh international unit. And after 1 year of age, 2 lakh international unit on the first day. And the same dose will be followed for the second day. And then every 2 weeks, the same dose has to be followed till the vitamin A serum level reaches normal. Then the prevention strategies which we have implemented, one is the ICDS program, Integrated Child Development Services. Then we have the CSSM program, Child Safety and Safe Motherhood program. So this kind of nutrition education, what is the importance of vitamin A, good sources of vitamin A. If you are deficient, what will happen to your child, what will happen to you, your vision, etc. All these things is given, this counseling is given to the mothers, expecting mothers, lactating mothers, as well as the mothers of the child who are in kindergartens, preschool, etc. There are Anganwadi ayas and other officials who are working with these two programs. They are on field duty. Okay, with the help of PHC, with the help of community health centers, they will be on field duty. They will be taking role plays on the street. They will be going door to door, giving health education and examination. They will do physical examination of the kids, eye examination, etc. So that's how they track down each cases of xerophthalmia and try to cover their entire community with the nutritional education. Then we have supplements of vitamin A, like giving them the posters or brochures of food which is rich in vitamin A, like carrots, pumpkin, spinach, dark green leafy vegetables, papayas, etc. Supplement them with that, or at least have your local farmers or school gardens. If it is a government school, help your school gardens to grow and cultivate these items. Then red palm oil is supposed to be very rich source of beta carotene, but red palm oil is not extensively used in India. Okay, to give impart the knowledge of using that palm oil, how to use it in the cooking food, or how how it is available. When it is available privately, nobody will buy that. But along with the government subsidiary programs, red palm oil should be supplemented. It should be distributed to, especially in the areas where we see high prevalence and incidence rate of vitamin A deficiency. That's the way how government is focusing it as of now. But no individual will go privately and buy red palm oil. If it is supplied by the government subsidiaries, then only they're using it in their food, etc. Then in curriculum, um, from the primary school itself, in their curriculum, brief topics, small lessons on vitamin E deficiency, how to prevent that, it should be given to the kids. So sometimes what happens is their parents will be literate, their parents may not be knowledgeable, but we are making these children as the change agents by incorporating in education to these children and expecting the children to teach their family members. So that's how school curriculum can help. Then we have some horticultural inventions like golden rice. Okay, you can see the image here, how a typical white rice looks like and how we get the golden rice. So golden rice is kind of genetically engineered with the infused beta carotene in it. So it's a very good source of beta carotene. So in all the third world countries, like developing countries and some African countries, they have successfully used the and incorporated golden rice. It is available in India also. Swarma, we call it as swarma in India. Okay. There are some drawbacks to it. While growing this particular variant of rice in India, we have seen that the paddy fields are not giving enough yield of this particular variation of rice. Okay, the rice plants have a stunted growth, especially the golden rice plants. They have a stunted growth, so the farmers are not getting a very good yield out of this golden rice. That's one drawback here. But in other countries like African countries, Nigeria, etc., they have successfully incorporated golden rice, and they are treating the community level blindness to a very good level. Then we have cassava or tapioca. We can see here how a conventional cassava or tapioca looks like, and this is a vitamin A biofortified cassava. Okay, again, it has a yellow tint to it because of the presence of beta carotene. It is very rarely found in India, but in South African countries like Nigeria, etc., they are using cassava rice, they are using cassava flour in their cooking, etc. So that's how they are dealing with the vitamin A deficiency. Then at village level, we can have nurseries which can give out saplings of like papaya plant, or any other good source of vitamin A plants like the saplings of and the shoots of the carrots, um, the saplings of drumstick trees, etc. Okay, that can be distributed at a very cost efficient manner in the village level, the rural areas where people can actually afford it. They can grow it in their backyard, etc., and use it. Krishi Vigyan Kendras have incorporated various curriculums for the farmers who are the members of Krishi Vigyan Kendras, and are teaching them, continuously teaching them the importance of growing vitamin A, the sources of vitamin A in their backyard or in their agricultural field. Okay. Cassava means tapioca. In India, we call it as tapioca. Okay, in some part of the world it is called cassava, it's called as tapioca. It's a very common staple food in southern states like Kerala, Tamil Nadu, etc. It's a staple food. Okay, even the tapioca is used to make sabudana. Some variants of sabudana is made by tapioca. Okay. And school gardens, it will help to maintain a physical activity level among students also, because gardening is a physical activity extensive workout. Okay, so school gardens will make sure that children are interested in agriculture. They know how to cultivate plants, and they can use the same tricks and strategies at their home, and what they're learning while gardening in the school, they can give the same knowledge to their parents, to the family back home, so they can take the knowledge back to their community. So that's how school gardens and kitchen gardens will help. Okay. So about cassava, the yellow cassava which you see here, that is the biofortified cassava. It's very rare in India. We are not seeing it much. Again, the golden rice also has some drawbacks, but in other countries, these strategies, these biofortified foods have been successfully used, and it is preventing blindness and xerophthalmia to a certain degree because of this uh, inventions, etc. Yeah, this is the National Prophylaxis Program against the nutritional blindness. Vitamin A syrup, along with the syrup bottle, the spoon will be given, and the PHC workers, the nurses in the PHC, the Anganwadi ayas, etc. They have the knowledge of how to use it. Okay, what is the 1 teaspoon will have around 1 lakh international unit of vitamin A. 2 teaspoon will have 2 lakh IU vitamin A. Okay, that kind of knowledge they have, and they know based on the immunization schedule what the child has received previously, how much dose they have to give in their subsequent visits, etc. Yeah, even I am from a South Indian state, but I have not seen it that in Bangalore, etc. We have not seen the yellow tapioca everywhere. White tapioca we can see everywhere. Okay, but yeah, even in Kerala, it is not, the white tapioca is common, but yellow we have not seen it. White we have seen, but yellow, yeah, the yellow tapioca, the yellow cassava, we have not seen it much. So this is the prophylaxis which we are giving to 6 to 11 months old child. Um, Once in every 6 months, 1 lakh IU of vitamin A should be given, and up till 5 years, every 6 months, 2 lakh IU of international unit of vitamin A should be given. If you have eyesight issue, that it is not just the reason vitamin A deficiency. There will be other factors, the screen time, etc., the stress level, your genetics. Okay, if your parents have poor eyesight issues, okay, it is transmitted to the children also. There are various factors which will lead to myopia and hypermetropia, etc., uh, or astigmatism. There are various factors to it. Okay, vitamin A deficiency would be one of the reasons to it. Okay, you can't completely blame it on vitamin deficiency, but yeah, it can be one of the factors which may have led to myopia or hypermetropia in your case. But there are other several factors which will lead to eyesight issues. If you have night blindness, it means you are deficient in vitamin A. Okay, so that is something you have to test personally, from moving from bright room to a dim room. Check yourself how fast you can accommodate your eyesight back. It should not take time. Usually, it should not take time. Immediately, your eyes should be able to accommodate itself from bright light to night dim light. If you are finding it like 5 seconds or more than 5 seconds for slowly adjusting your eyes to the dim vision, it means you are deficient in vitamin D. Otherwise, if you just have the eye power issue, morning, day, doesn't matter. If it's just an eye power issue, there may be other factors to it. So again, in the same prevention category, prevention of infection, all the immunization schedules from the BCG vaccine to the all the dosages of oral polio vaccine, tetanus toxoid vaccine at the age of 10, 16, etc., rubella vaccines, all this immunization schedule should be followed. So the immunization schedule, universal immunization schedule, will help prevent infection among, especially among preschoolers, and it can prevent xerophthalmia. Fortification, yeah, here you can see Avin is a milk brand which has been issued in the state of Tamil Nadu. So it is said that a 500 ml package of almond milk has around 1,000 international unit of vitamin A. So the Tamil Nadu government has funded for this particular brand of milk to be fortified with vitamin A. And then we have dalda. Here you can see if it is visible to you. If you can just zoom into your screen, you can see contains vitamins A and D. So this particular dalda is fortified with vitamin A as well as vitamin D. So vanaspati fortification is done, and nowadays the atta which you get in the market like Ashirwad atta, etc., you can see that in the first on the packaging itself they must have mentioned that it is fortified with so vitamins so and so, minerals so and so. Okay, the Ashirwad atta, some salts, some varieties of salts are also fortified with vitamin A. Okay, but these are the three common things. The atta which is readily available outside like Ashirwad atta, etc., this form of dalda, and almond milk. Dalda, yes, it is. It has certain drawbacks on health, but the thing is, people who are from low socioeconomic background, they use dalda instead of ghee, etc. Okay, they use dalda as a source of fat instead of ghee because it is cost effective for them. So that is the reason why, since the government can't provide other fat sources, other sources of lipids or visible fats, but the what the government could do here was fortify dalda, so at least this vitamin deficiencies are taken care of. Okay, so that's the technique which they have used here. Dalda, obviously it has certain drawbacks on health, but since a lot of people from poor families and low socioeconomic background, they depend on dalda, we have fortified that to counteract the deficiencies. Okay, then coming to biofortification. So yeah, it is genetic engineering. Okay, genetic engineering, either the plant are able to plant which is been genetically engineered, this plant is able to make new nutrients, or they are at least able to accumulate small levels of micronutrients so that the consumers can meet their daily requirements. Okay, so that is the use of biofortification here. So yeah, golden rice is a good example for that. So you can see white rice and golden rice, and after cooking the white rice and golden rice, it looks almost similar except for the yellow tint which the beta carotene gives here. So the main purpose of this biofortification is to provide vitamin A to the developing countries who can't afford animal sources, lots of animal, because when it comes to animal sources of vitamin A, it comes with a cost factor. And since this is already poverty-stricken world, poverty-stricken countries, etc., some of the South African countries, etc. So to contract that in a very cost-effective manner, their own government, along with the help of WHO and other FAO organizations, they have supplied this. They have sponsored the genetic engineering of golden rice, and it is successfully been implemented in their day-to-day lives. Any doubts about this topic, please mention in the chat box. If you have any general